Terrence Higgins Trust THT is increasingly involved in providing services for children and young people. In addition, it is increasingly likely that the charity will be providing services for people responsible for caring for children and young people. THT aspires to the highest standards of corporate behavior and clinical competence, in order to ensure that safe, fair and equitable procedures are applied to all care provided to children. All children have a right to be safe and protected from harm. Safeguarding children procedures were made more robust across healthcare providing organizations, in order to implement the recommendations from the Laming Inquiry 2003, which followed the death of Victoria Climb-BE in 2000, and to ensure effective systems for the safeguarding of children. The inquiry highlighted significant failings in social services, health and police systems, that led to Victoria not being protected. THT therefore has a moral and legal obligation to strive to protect children and young people who may believe to be abused or at risk of abuse or neglect. The responsibility to safeguard children and young people extends to all agencies, and the voluntary sector will be required to demonstrate a commitment to ensuring that the safety and welfare of children and young people is paramount. Furthermore, as an organization which provides access to sexual health advice and clinical care, THT is obligated that all staff are aware of, know how to access, and know how to implement safeguarding procedures, which adequately address suspicion or disclosure of sexual offenses, such as grooming and underage sexual contact. These must assure relevant raising of concerns, information sharing and formal reporting. It is important that as a charity providing services to young people, we can demonstrate our commitment to safeguarding those young people. At every level of the organization there is a requirement to be familiar with the child protection protocols and organizational lines of accountability. Terrence Higgins Trust considers that every child or young person deserves to be happy and secure in their activities, and their parents or guardians need to feel sure that the people in charge of these activities are trustworthy, responsible and will do everything they can to keep the child or young person safe from harm. The charity recognizes that sometimes people who work or volunteer with organizations providing services to children and young people may pose a risk to children and may wish to harm them. THT's duty therefore is to put in place safeguards to protect the children and young people with whom they work, through safer recruitment practices and policies. The charity also wishes to avoid putting staff and volunteers in positions where abuse might be alleged, and to ensure that all staff know exactly what to do should abuse be suspected, or they are uncomfortable working with a specific young person. The emphasis is not only to protect young people from abuse and neglect, but to actively promote the safeguarding of their overall welfare and well-being. Alongside this policy there are a range of THT procedures intended to underpin implementation of the policy in everyday practice. THT has a responsibility to ensure that all staff and volunteers receive the appropriate level and provision of safeguarding training as well as access to role-appropriate regular updates and supervision. The charity has a responsibility to continually review and monitor its safeguarding policy and procedures, seeking further advice and information wherever possible. All staff and volunteers should be aware of this policy and its associated procedures in order to understand their individual responsibilities and to assure best practice. THT's staff and volunteers are not responsible for diagnosing, investigating or providing a therapeutic response to abuse. However, they have a responsibility and duty of care to be aware of and alert to signs and indicators that a child or young person is being abused, and how to deal with that situation and report it appropriately. Not all concerns will result in establishing evidence of abuse, as there may well be other explanations. That said, it is important to keep an open mind and consider what you know about a child and his circumstances, and to seek advice and guidance if abuse is suspected or disclosed.